Billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Now, continuing my efforts to repeat the infectiology, that is infection and the disease, there are some bacteria which are overlooked and they should be included in the differential diagnosis. And these bacteria are important when you are appearing in the examinations like MCPS and FCPS in Pakistan and MD in internal medicine in Pakistan, or MD in infection and disease in Pakistan. And also those who are appearing in the FCPS surgery also, they should know these type of the bacteria. Because I am actually eating the gram-negative BACILLI. First of all, I have told you the gram-positive cocci, then gram-negative cocci, then gram-positive BACILLI of the medical importance, and the gram-negative BACILLI of the medical importance. Although this subject is boring and dry one, but one should know. I already said that every part of the medicine should be known to the person who is appearing in the fellowships examination or in the examination, higher examination in Europe and in America, because they will ask these things, because they can detect these bacteria. Rather, in our country, where there are lack of facilities are there, that is why they are missed, many of us. Now, it is Yersina type of organism. Yersina is the genus. Yersina enterocolitica, Yersina pseudotuberculosis. The most important one before this is the Yersina pestis, which can cause what is called black death, and that is it is called as plague. At one time, it is in pandemic nature or epidemic nature, killed millions of population before the birth of the Muhammad, peace be upon him, and the Hazrat Isa alayhi salatu wasalam. Before that also, this type of infiltration of the bacteria causing the plague. And they said that they are very, very ancient times since it is present. If the Almighty God wants to, what is called azab to the nation, there are many forms of it. And one form is this, because it will eat up millions of the persons. It can easily kill the whole population in a due time, 2 weeks rather, maximum. So plague was the old disease. I have actually not, given any lecture on the Yersina pestis, because it is one of the it is used as a microbiological warfare bacteria, and the policy of the YouTube is because it is against to popularize those microbacteria who are considered to be used in the microbiological warfare, which will create a negative impression on the people who are listening and who will listen afterwards. I left it, that's why. Previously it is BACILLI anthrax, which was deleted from the YouTube, because it is again the same. It is a microbiological warfare weapon or a bacteria. I am Professor S.A.D. Haider, and I am honorary global professor of medicine. I don't want any name or fame or economics, just for the sake of the knowledge. I am delivering these tutorials. Anyway, now Yersina enterocolitica and Yersina tuberculosis. Introduction is that these are gram-negative bacillus shaped bacteria belonging to the family Yersinicae. The family is Yersinicae, and the genus, which we call is the Yersina. It is motile at temperatures of 22 to 29 degrees centigrade, ideal for Karachi and the other populations around Karachi, but becomes non-motile at normal human body temperature. It is a miracle from the God that is around 37.5 or 37.2. It is a normal body temperature. It becomes non-motile. That is why it will not harm you. Sometimes the temperature of the body is useful to kill the bacteria naturally. So what are the advantages of the fever? I have asked previously, I think 6 months back. Yersina enterocolitica infection causes the disease which is known as Yersinosis, which is an animal-borne disease, that is a zoonotic disease occurring in the humans as well as a wide array of animals such as cattle, deer, pigs and birds. So it is also a subject of veterinary surgeons. Many of these animals recover from the disease, then they become carriers, and these are the potential sources of the contagion despite showing the no signs of disease. That is called, they are carriers. The reservoir infection, therefore, it is basically that the virus spreads in nature, occurring in the reservoirs ranging from the intestinal tracts of the numerous mammals, avian species like birds, invertebrate species like frogs and snakes, and even from the terrestrial and aquatic niches. It is a zoonotic disease. Aquatic niches are, these are the different type of the fishes and the derivative of the fishes. Fish, you can say. Specifically speaking, those fishes who are stored in the cans. The most environmental isolates are virulent because at the normal body temperature, I already said, they are present as a part of, I will say, the coliform bacteria. However, isolates recovered from the porcine sources, which are not used in our country, contain the human pathogenic serotypes. But in the dogs and sheep and the wild rodents, and the environmental water may also be a reservoir of pathogenic Yersina enterocolitica strains. Human pathogenic strains are usually confined to the intestinal tract and lead to the enteritis and diarrhea. So this is the reservoir infection. This is the part of the pathogenesis. The clinical feature is that the portal of entry is GI tract. The organism is acquired usually by insufficiently cooked pork or contaminated water. Pork is not used in our country in most of the cases, but it is contaminated water, meat other than the mammalian meat, or the milk. So it is a disease which can be spread from the derivatives of the animals. In the recent years, the Yersina enterocolitica has increasingly been causing smaller outbreaks via ready-to-eat vegetables, which are available in the supermarkets. Acute Yersina enterocolitica infection usually lead to the mild self-limiting type of enterocolitis, or it can lead to the terminal iritis and adenitis in humans. Therefore, there is a pain in the right iliac fossa, possibility of the pain with the diarrhea, possibility also of the fever, the signs of inflammation, arthralgia, etc. Now, Yersinosis symptoms may include watery diarrhea or blood diarrhea. It depends upon how much surface area of the terminal ileum is involved. And the fever resembling, it will resemble because right iliac fossa, there is pain, there is vomiting, and with the arthralgia, and there is a diarrhea. It may be associated with blood also. That is what is called, I will say, hematochezia, salmonellosis or shigellosis. This is a very important differential diagnosis of acute appendicitis, salmonellosis. The terminology I am using is salmonellosis, or shigellosis. This is the causative agent of the bacillary dysentery. After the oral uptake, Yersina species replicate in the terminal ileum, replicate. It is the part, it is the most part which is involved as affinity to that area is the ileum, and before it will invade the pile patches. Again, the pathogenicity or pathogenesis is just resembling with the salmonellosis. That it will disseminate further to the mesenteric lymph node, causing lymphadenopathy and confused with the appendicitis. That is why it is called the pseudoappendicitis. In immunosuppressed individuals, they can disseminate from the gut to the liver and the spleen and form abscesses elsewhere in the abdominal wall and others. So it forms the pain in the right iliac fossa, and there is a bloody descent, diarrhea, and the formation of abscesses. So again, it is one of the inflammatory bowel diseases which can cause this type of problem. And you know that that is a part of it, of the inflammatory bowel disease, specifically speaking, the Crohn's disease. They can disseminate from the gut to the liver and the spleen and form abscesses. Yersina species are siderophilic bacteria. They are iron-loving bacteria. People with the hereditary hemochromatosis, a disease resulting in the high body iron levels, and some cases of the acquired hemochromatosis also, they are more susceptible to this infection. Remember, this is one of the complications of the hemocytosis or hemochromatosis. Or those people who are taking the iron supplementations and they have given the chance of the portal entry of this organism, they will cause and this will cause a disease in them, because it's a siderophilic type of the bacteria, likes the iron for the growth. In fact, the most common contaminant of the stored blood in the blood bank is Yersina Enterocolitica, because the hemoglobin, some part of the blood which is stored, is hemolyzed and iron is related, and if it is contaminated, then Yersina Enterocolitica will be present in the stored blood. Management is usually, in most of the cases, it is the self-limiting disease. Some pain occurs in the right iliac fossa, and diarrhea will subside. Diarrhea occurs, subside in 1 to 2 days. But those people who are showing the signs of inflammation, and those people who are associated with immunosuppression, then they should take the doxycycline. It is vancomycin, which is in a trade name, 100 milligram, should be given first 100 milligram BD, along with the one aminoglycoside, which I like, gentamicin, 80 milligram intravenously. It is not oral drug, it is the parenteral drug. So combine the doxycycline with aminoglycoside and should be given 7 days. Other antibiotics active against the Enterocolitica include the trimethoprim sulfamethoxazole, which is called Saptron. Children, it is specifically very good. Fluoroquinolones, like for example, you are using the first generation or the second generation or the third generation. Ceftriaxone, which is the third generation drug, and chlorphenicol. Remember that it is usually resistant to the penicillin G, that is crystalline penicillin, or regular penicillin, ampicillin, and cephalosporin, which is its first generation cephalosporin, due to the beta-lactamase production. But you can give augmentin because it is resistant, beta-lactamase resistant type of drug, is a broader spectrum drug. So the augmentin, which is a combination of the clavonic acid with amoxicillin, can be helpful. But multi-drug resistance still have been reported in European countries, not in our country. Most of them they are, it is a self-limiting disease, but both those people who are showing the signs of inflammation and mimicking the appendicitis, bloody diarrhea, or worsening day by day, you will use these drugs which I have mentioned. Prognosis is important. Those people who are appearing in the FCP's examination. Now, association of the disease is very important. They are sometimes followed by the aggravating disease to form the chronic inflammatory diseases such as arthritis, and it is a reactive arthritis, basically. Erythema nodosum is associated with the disease. This is most likely because of some immune-mediated mechanism. So, seronegative arthritis can occur, reactive arthritis can occur. The provoking bacteria is Yersina, Enterocolitica. And another important association is with the autoimmune Graves-based drought thyroiditis. The Graves disease, which is Graves-based drought thyroiditis. It is not Graves, but it is Graves-based drought thyroiditis. The George-based drought phenomenon, you know that about it, and the Chekhov effect. Now, based drought phenomena usually occurs because of you have taken the iodinated salts or higher iodinated salts. Possibly in those people, it will cause the formation of the free T3 and free T4. It will cause the signs of hyperthyroidism. But in case of the Chekhov effect, the higher iodinated compounds can cause the suppression of the iodine peroxidase and it will cause the hypothyroidism. There are two phenomena that are going. It depends upon how much iodine has been taken and what is the comorbids are associated. Now this is the actually important one. It is the associations. While indirect evidence exists, direct causative evidence is limited, and Yersina enterocolitica is probably not a major cause of this disease. But many contribute to the development of the thyroid autoimmunity arising from the other reasons, and mostly are genetically susceptible individuals. So if they are genetically susceptible, if they acquire Yersina enterocolitica, the disease will be provoked, and this will cause the enteric type of the presentation with hyperthyroidism. So which diarrhea can cause the hyperthyroidism? This is the question. Simple as that. The Yersina enterocolitica infection has also been suggested to be not the cause of autoimmune thyroiditis. It is not directly caused. It is a provoking cause, rather an association condition with both sharing a common inherited susceptibility. It may be superintelligence, it may be molecular mimicry phenomena. More recently, the role of the Yersina enterocolitica has been disputed. Which type of the pathogenesis is going on, causing this type of problems. Another species is Yersina pseudotuberculosis. From the name, it should be diagnosed, it should be under the differential diagnosis of the tuberculosis. I will say tuberculosis is the differential diagnosis of any disease. The Yersina pseudotuberculosis is a gram-negative bacterium that causes far yeast scarlet-like fever, just like scaldiform rash. There is tonsillitis, there is inflammation of the mouth, glossitis, etc., along with the specific rashes. It's seen in the Far East countries like from the Burma and going on lower down to the Philippines and Indonesia, who occasionally get infected zoonotically. It is a zoonotic disease, yes, most often through the food-borne route. So canned food or stored foods or easy-to-cook foods can cause this disease. Animals are also infected by the Yersina pseudotuberculosis. The bacterium is urease positive. Because it is urease positive, the uric acid will form in the intestine, not in the stomach, but in the intestine. It is urease positive. The pathogenesis and clinical features that in animals the Yersina tuberculosis cause the tuberculosis-like symptoms, including the localized tissue necrosis, and it can form granulomas in the spleen, liver, and lymph nodes. So it is a cryptic type of a tuberculosis, which we are investigating, and when the biopsy was done and the culture was done, then this bacteria was present. So it was not the H. was BACILLI, but the Yersina tuberculosis or pseudotuberculosis. It is very important to discard this in the differential diagnosis of the localized lymphadenopathies and granulomas in the liver, that is granulomatous type of hepatitis, even in spleen and lymph nodes. So direct evidence should be there. In humans, the symptoms of the Far East scarlet-like fever, not in our country, I have never seen these cases, are similar to those of the infection with the Yersina enterocolitica fever and the right-sided abdominal pain. Same one as Yersina tuberculosis ले लें या Yersina pseudotuberculosis ले लें, enterocolitica ले लें, fever and the right-sided abdominal pain. It is a differential diagnosis of the right-sided right iliac fossa, pain, bloody diarrhea, and signs of the inflammation in the body. So it should be included in the differential diagnosis of appendicitis, differential diagnosis of the Crohn's disease, differential diagnosis of any dysentery, especially in the children and younger adults, and the rare cases the disease may cause skin complaints, erythema nodosum, just like Yersina enterocolitica. Joint stiffness and pain, that is reactive arthritis. It is a seronegative arthritis, or a spread of the bacteria to the blood, again from the prior batches, due to the bacteremia, septicemia, pyemia, and SIRS and MODS, etc. And that is the inflammatory path. For Far East scarlet-like fever usually becomes apparent 5 to 10 days after exposure, specifically speaking in children, and typically lasts 1 to 3 weeks with or without treatment. It is a natural history of the penetration of the bacteria. Although mostly they recovered, 95% or more of them, they are recovered automatically. But if the disease is troublesome, the same therapy will be given as you have already mentioned. I have already mentioned out in the Yersina enterocolitica, that is you did doxycycline 100 milligram BD with 80 milligram gentamicin 8 hourly for 7 days at least. It is more. If it is scarlatiform rash occur, you will treat the patient for more than 14 days to avoid the inflammatory path. The recently described syndrome, it is called Yersina fever, published in the Dawn and the other journals also. This is linked with the Yersina tuberculosis. Actually, Yersina fever is the fever which was demonstrated in the Far East countries. The same one I say. Scarlatiform rash, diarrhea, bloody diarrhea, and because of the mediastinal lymphadenopathy, there is a mass in the right iliac fossa, etc. And it is started as initially with the food poisoning, classical food poisoning. Starting with this, ending with this. Although the Yersina tuberculosis is usually only able to colonize hosts by peripheral routes and cause serious disease in immunocompromised individuals. Talking about the HIV, or those people who are on the steroids and immunosuppression, or those who are, they are uncontrolled diabetic. This bacteria gain access to the bloodstream. It has an LD50 comparable to the Yersina pestis, very, very near to it. At only 10 colony unit. So it is the CFU unit they are using, colony factor unit. The treatment again the same. I will say that it is I will use rather the same one. Already mentioned out it is gentamicin 80 milligram 8 hourly plus doxycycline, or you can go for the quinolones groups, and they are effective. Even they said that in Yersina tuberculosis are also effective via ampicillin and the chloramphenicol and first generation cephalosporin, because it will respond. But in Enterocolitica they are resistant. So I like to give the same one I already said it. That is gentamicin 8 hourly in IV, and the secondary drug is doxycycline 100 milligram BD orally. So these are the small presentation which I want to give you, because you should understand what is Yersina enterocolitica and Yersina tuberculosis. Although this is a very dry subject, I should understand, I may understand, but you should know, because you are appearing in the examination. They can ask any question. In the differential diagnosis, you have made a person who has got a pain in the right iliac fossa, and he has developed fever, arthritis, bloody diarrhea, local abscesses, etc. It should include. وما علينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.